Hey everybody, Dr. Patel here. Today we're going to be talking about bone spurs. I hope you all are doing well. It's been a couple weeks since I've been on. I was actually out in Florida teaching at a big orthobiologics conference, and it was fantastic. Always great to teach people about the type of treatments that we can provide. And also, it's great to learn what other people are doing across the world, some of which is very much in line with the things that we're doing in this office, and some of which is really interesting, really profound, and exciting to see where the research goes, because we'll be able to bring fantastic new treatments into the fold as we move forward. And one of the things that we discussed in the conference, which we teach and learn about all the time, is osteoarthritis. So we're definitely going to be talking about osteoarthritis of the knee today. But really, a lot of what I'm going to be talking about is applicable to arthritis conditions that can affect our whole bodies. Next week, I am going to be out again because I'm going to be teaching at another conference in Florida. But then I'll be back the following week. And moving forward, we're going to move off of the knee and go to some other topics. If there's something specifically that you want me to discuss, then please feel free to comment, DM, or email us at info@fxregencenter.com. And if you like this video, please like, subscribe, and share with all of your friends. And if you have questions while I'm doing this, then feel free to comment. I'll try to be looking periodically and answering. So Danny said, "Hey Danny, thanks for joining us. So important that all medics around the world listen and come together." That is so true. Complete side note, but we really should be expanding our knowledge base and exploring and learning from each other. Not everybody knows everything, and the more we collaborate with people, the more we learn and more we start to understand the body and understand all of the different possible treatment options out there. Because way too often, patients are told that, hey, I have X, Y, and Z. Hey, my knee is bone on bone. Or, hey, I have bone spurs. So therefore, the only option is surgery. And what's really fascinating, based off of the treatments that I've provided, the data that we have collected, and the patients that we have seen benefit from our treatments, as well as looking at all the other treatments that other folks are doing at these conferences, we can oftentimes avoid surgery in many circumstances. Sometimes surgery is absolutely necessary, but that is something that we can avoid even in severe arthritis situations. So just because you were told that you have a bone spur does not mean that surgery is your only option. Surgery might be the only option that your surgeon has for you, but there are a lot of different options that are available, and the reality is that a bone spur might not even necessarily be the thing that's causing your symptoms. So, that being said, what are bone spurs? Right? What exactly is a bone spur? How does it form? Is it as simple as just take away the bone spur and you don't have pain anymore? Or is the bone spur actually a sign of something else that is going on that needs to be addressed? So I'm going to answer all these questions and more. But first, a word from our sponsors. No, I'm kidding. Okay, so this picture here is pretty tremendous. It's more of a late stage osteoarthritis of the knee. But I'm going to do a little bit of drawing and kind of lay out what exactly happens when we have osteoarthritis and what is it that causes bone spurs to occur. So first and foremost, let me bring this down a little bit here. And I'm going to draw out a real rough sketch of what a knee joint looks like. So first, a normal knee joint essentially is where the thigh bone meets the lower leg bone. Okay, so there's my thigh bone here, and this is my lower leg bone here. And we have two lower leg bones. We have the tibia and the fibula is right there. So this is as if we're looking straight at the right knee. Okay. Now, these are where the two bones meet. Well, there's a bunch of different structures that are here. First of all, there's one other bone here that's called the kneecap that kind of sits in the front here. And the kneecap sits in this nice little groove that's formed at the end of the thigh bone. Okay. And there's a smooth surface called the cartilage that essentially surrounds the bone and borders where the kneecap addresses the end of the thigh bone here. And this smooth surface covers the end of the thigh bone, but it also covers the end of the lower leg bone, the tibia. And that smooth surface, that cartilage, is what allows for nice smooth movement inside the knee. We also have another couple structures called the meniscus, or menisci, plural. And the menisci are these shock absorbers that sit on either side of the knee here. Okay? You have one there, and you have one basically here. Okay? And these shock absorbers here, these are like the shocks in our car. So they're like they're cushions essentially that provide support to the joint, and there's one on each side. On the inside of the joint, there's the medial meniscus, and on the outside of the joint is the lateral meniscus. And these shock absorbers provide shock absorption. They provide cushioning for the joint. So with every step that we take, we're not just smacking our bone on top of the bone. We have these cushions in between. We have other structures throughout the joint. We have these things called ligaments. The ligaments are things that connect bone to bone. And there are ligaments that connect these bones together. There are ligaments that connect these bones together here on the outside of the knee. And then there are ligaments that are deep inside the knee as well. So on the inside of the knee, we have your MCL. On the outside of the knee, you have your LCL. And then deep inside your knee, you have your ACL and your PCL. Okay. And these ligaments are essentially structural support. We have other ligaments as well. There are ligaments that connect the kneecap together. There are little known ligaments, ones that were just actually recently discovered like a decade ago. And these are basically thick, soft tissue structures that connect bone to bone and provide support. You may have heard me say this before, but while some people describe ligaments as duct tape connecting bone to bone, the way that I describe it is that those are thick rubber bands that surround broccoli in the grocery store. And those thick rubber bands, they're strong, they're supportive, but there's a little bit of stretch to them. Okay. Now this is an important thing. I know we're talking about bone spurs here. Why are we talking about soft tissue, right? Well, the reality is that the ligaments end up playing a very important factor in the early stages of osteoarthritis. Osteoarthritis is the gradual degeneration of a joint that takes place over time. It's your wear and tear of the joint that takes place over time. And that's a normal thing. That's not something that necessarily causes pain or discomfort. It can become painful, and I'll explain why in a few. And it can cause things to occur, such as bone spurs. But osteoarthritis inherently itself does not necessarily equal pain. Well, what causes that arthritis starts with various different things. One of the common things that causes arthritis is trauma or injury. So if we've had a specific injury to our knee, if we've twisted our knee and torn our meniscus, if we had a car accident, if we had a sports injury, it could be anything. And if we had an injury, then that can predispose us to osteoarthritis. It's called post-traumatic osteoarthritis, right? If we haven't had an injury, but we have been moving funny, if our biomechanics, if the way that we move has been incorrect, for lack of better words, over time, then that can also cause osteoarthritis. Now, I'm not saying that can cause pain necessarily, but that can cause osteoarthritis over time, and I'll explain why. Now, if we're moving in a manner in which we're constantly putting some stress or stretch onto areas of the joint, then that can start the cascade of degeneration. So what do I mean by that? If we are moving this knee, and with every step that we take, if our hip muscles or butt muscles are not firing properly, or if we have a history of an ankle injury or ankle sprain, and with every step that we take, our knee is actually going outwards or inwards, right? If our knee is actually going in this direction, this direction, that's a really, let me see if I can widen that a little. Give me a second. Pop, 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 pop. If our knee is going in this direction or in this direction, right, then that's a scenario where there could be stress or stretch placed on structures such as the ligaments. So I'll explain to you what I mean by that. Let's see if I can do some Photoshop magic here. All right. So if this knee, for example, is going towards its left, so if it's going towards this side of the body, then what happens is if the knee is going in this direction, the knee joint is actually bending. Right? So it's actually bending like this. And if you can see what's happening in this situation, your knee is getting more knock-kneed. And that as that occurs, we start to get a stretch of the MCL ligament. Now, I mentioned that this ligament is like those rubber bands that surround broccoli in the grocery store, right? They're stretchy, they're strong, but imagine with every step that you're taking, you're gradually stretching that ligament. Well, that ligament is going to get looser. That rubber band is going to get looser. Not only is it causing a stretch over there, but it's also causing compression on the other side. So it's stretching in this area and causing compression in this area here. So your meniscus, your shock absorber on the outside of the knee is going to start to get more and more pressure, right? The shocks are going to start to wear out and we're going to get degenerative tears in the meniscus on the inside of the knee. Now, a combination of the ligament getting stretched on the inside of the knee and the meniscus getting compressed on the outside of the knee, over time, this causes some instability to occur inside the knee joint. So with that instability, that looseness that's occurring inside that knee joint, we might not even feel that symptomatically. We might feel things like some weakness in the knee, or we might feel things like your knee buckling or something along those lines. But over time, your bone is actually a smart thing. The bone is like, hey, there's a lot of instability going on over here. So the bone, unlike the models that we think about or the skeletons that we get for Halloween, that it's not a static structure. The bone is actually a living, breathing organ. And that bone reacts to the excess friction or excess instability that it feels going on. And the bone's like, crap, there's a lot of motion that's going on here. I gotta actually bulk up in order to try to provide stability. So as this motion is taking place, the bone actually starts to change. This bone may actually start to get bulkier in order to provide stability for that part of the knee. And that is called a bone spur. And more specifically, that is called an osteophyte, which is when the bone starts to get bulkier, it starts to increase in size in areas where there's excess friction or compression. All right? That's one of two types of bone spurs that occurs, but one of the most common bone spurs that we think about and see on imaging when it comes to knee osteoarthritis. Now, as that bone spur starts to occur, over time, that bone spur can get bulkier and bulkier. They could actually get bigger and start to form even more stability. And over time, the condition that starts with instability and looseness, over time, the bone starts getting big enough to actually provide the stability that it has been trying to do. And then we start getting decreased range of motion. We start getting stiffness inside the joint. And ultimately, we start getting deformity that occurs in the whole joint overall. Now, this is just one example of how the joint can move. You may have noticed people, or maybe yourself, that has a bow-legged appearance of the joint rather than this knock-kneed appearance. In actuality, the knock-kneed appearance, the bow-legged appearance, or the knee bowing outwards, is actually more common than even this knock-kneed appearance. And what that looks like is this. So in the bow-legged scenario, the knee is actually going in this direction here. Now, there's a few different factors that lead to bow-leggedness or a knock-kneed appearance. One of those factors is genetics. That's something that gets unfortunately passed down from generation to generation. If you have family members that are more bow-legged, it is more likely that you are going to be bow-legged. But some of these factors also come from various injuries that we may have had, even small injuries, that have accumulated over time as we've gotten older. Being knock-kneed can occur again via genetics, but actually also commonly occurs when we have, flat-footedness, or even when we have hip issues, or even if we have a pinched nerve in the back, which can cause the muscles of the hip to not fire properly and therefore cause our knee to go inwards with every step that we take. But this bow-leggedness ultimately involves the ligaments on the outside of the knee getting stretched, right, as this is happening, and then the meniscus on the inside of the knee starts to get compressed. And as this bow-leggedness occurs over time, kind of the opposite scenario than the previous case takes place, where we start getting bone spurs on the inside of the knee to provide stability here. Okay. Now, do the bone spurs actually cause pain? Well, the answer to that is actually not always. Sometimes bone spurs can absolutely cause pain. If bone spurs are getting big enough that they start actually aggravating other tissues. So if this bone spur is big enough and starts aggravating something like the medial collateral ligament, that medial collateral ligament can start to get stretched. It can even start to get torn on the undersurface if this bone spur is causing aggravation to it. Like if it's big enough, it's sawing away at the undersurface of the MCL. Certainly, that's something that could cause pain. But if that bone spur is not pressing on any specific substance, in actuality, the bone spur is the effect and not necessarily the cause of your symptoms. Now, if it's not the bone spurs when we have this arthritis picture, then what exactly is causing the pain? It's actually, a lot of times, the cartilage gets demonized. The cartilage gets, victimized as the source of pain. Because the cartilage, as we put pressure onto the inside of the knee, the smooth surface, the cartilage will start to gradually wear away. But that gradual degeneration of the cartilage isn't actually the thing that's causing the pain. We're starting to recognize that the pain generator may actually be the bone itself. Because we're seeing that areas like the bone can actually have changes occur on the vascular level, on the cellular level, that ultimately not only can become painful, but can also then contribute to the cartilage loss and can contribute to the mechanism by which the bone spurs occur. But long story short, bone spurs don't always cause pain. They're usually the thing that is a result of the biomechanics that are going on. Now, I mentioned earlier that there's two types of bone spurs. There are the bone spurs that occur, which are called osteophytes, that occur because of the friction of the joint. There is another type of bone spur that can occur inside the knee as well. So I'm actually going to draw a different view of the knee joint. And this is a side view of the joint. So when we look at the knee joint from the side, this is your thigh bone here. And here's your lower leg bones, right? And here's your fibula. And here's your kneecap that kind of sits in this nice groove over here. So this is the front of the knee. This is the back of the knee. Okay. And this this kneecap is connected to the thigh bones by a tendon called the quadriceps tendon. And this tendon basically comes from the thigh muscles. I didn't say thigh bones, I meant thigh muscles. So this kneecap is connected to the thigh muscles, and that is by the quadriceps tendon. Hold on a second here. I'm going to show you what I'm talking about. Okay. So this muscle, the quadriceps, which is the muscle in the front of the thigh, comes and attaches to the kneecap via the quadriceps tendon. And the fibers of this tendon actually continue over the kneecap here and then continue on as what's called the patellar tendon. And this guy ultimately attaches onto the lower leg bone, the tibia. Okay? And tendon, if you've heard any of my discussions in the past, tendon is what attaches muscle to bone. And the fibers of the tendon, as you can see how I've depicted it here, the fibers of the tendon are like the bristles of a paintbrush. All those bristles are nice and parallel, nice and compact, and all those bristles, those fibers, move in sync when we're moving in an appropriate way. Now, as we get older, and if we're moving in an abnormal fashion, or when we have an injury, or when causing repetitive stress, those tendon fibers can start to get disorganized. So what we see is those tendon fibers, instead of being nice and parallel, start to go in different directions. Okay? And that is called tendinopathy. Eventually, over time, that tendinopathy, by the way, does not necessarily equal pain, but that tendinopathy over time can become painful, can get inflamed, which is called a tendinitis. It can actually get tears, and can have other issues associated with it. But in the process, while that tendinopathy is there, over time, it starts to pull at the bone in an abnormal fashion. So looking a little bit closer at the tendon-bone interface, so now this is kind of a bone right here, and this is the tendon coming and attaching onto it, right? Nice healthy tendon, all those fibers are connecting onto the bone in the manner in which they're supposed to. But if those fibers are disorganized because those muscles are pulling abnormally, then you can imagine these tendons are no longer just pulling evenly on the bone, but now the tendon fibers are pulling all in different directions. So that abnormal pull onto the bone makes the bone react. And ultimately, the bone actually starts to change its shape in reaction to that excess pulling that's taking place. And that's when you get the second type of second type of bone spur that occurs, which is not at a joint where one bone meets another bone. It's not there to provide stability for excess instability, excess friction, excess motion that's taking place at a joint. But instead, these bone kind of spikes start to form because the tendon is pulling abnormally at that bone. And that is called an enthesophyte. So an enthesophyte versus an osteophyte, both of which are types of bone spurs that could be seen inside the knee or outside the knee. Now, similar to osteophytes, enthesophytes do not necessarily equal pain. But if this is going on for a long time, the bone underneath the enthesophyte can certainly get aggravated, and the tendon itself can get torn in the process. Ultimately, these are both types of bone spurs are the bone's reaction to things, the bone's reaction to abnormal movements, the bone's reaction to excess friction or excess pull. And then these bone spurs can cause pain if they are pinching or serrating soft tissue structures, but they're not necessarily pain generators. And these bone spurs can be completely benign and completely painless. Ultimately, there are treatments that we can do for these bone spurs. There are surgeries that can be done to remove these bone spurs. And sometimes, in certain circumstances, that's perfectly reasonable and a very normal treatment. However, it's very important to recognize if and when these bone spurs are actually causing pain, because if they're not the thing that's causing pain, they're actually trying to provide stability to the joint, and removing those bone spurs can actually cause more instability. And God forbid you take off the bone spur, you cause more instability, well then the bone spur will just grow back again. So the real treatment for a scenario where we identify bone spurs is to treat the underlying issue that's causing the bone spurs in the first place. In rare circumstances, by doing that, we have seen some bone spurs decrease in size, but more often than not, we're able to improve symptoms, improve pain, and the bone spurs end up still being there. And honestly, I don't care. Because again, as long as the bone spurs are not contributing to furthering damage, then those bone spurs can actually be perfectly benign. So that's my shtick on bone spurs. That's kind of how bone spurs form, the different types of bone spurs, when they are or are not painful. And there's a lot of stuff that we can do about that, but that is going to be a discussion for another day. I hope you all enjoyed this. Again, if you had any questions about this talk, or if this brought up questions about other body regions or other conditions, then please feel free to contact us. You can comment, you can DM, or you can email us at info@fxregencenter.com. If you'd like to talk about your particular situation, then please contact us. You can also call us and talk to our patient care coordinator at 310-929-9790. And again, if you like this video, if you found it helpful at all, please share it, like it, subscribe, the whole nine. And I will see you next time. Hope you guys have a great weekend and a great Father's Day weekend. Best wishes to you, and I'll see you in a couple weeks.